Okay, so let's just talk in concept about the total knee, total hip replacement patients. Okay, so the most important thing for those patients are to maintain eye contact when you're managing their lower extremity off the bed for bed mobility, right?
Yes.
Okay, because as soon as you touch them, they're gonna wince, you know?
Mm-hmm.
Okay, so you're managing their lower extremity off the bed. Now, remember too, for the hip patients with that troch slide precaution, right? Very important that you don't allow those patients to actively AB duct or straight leg raise, because with those troch slide precautions, you will automatically dislocate that hip. The troch slide means that you will slide their trochanter off the bed. Okay, if they can't do it, well, you have to assist. Okay? All right? Very important to remember that one story I told you about that one aide that was helping the patient to the commode, and she stepped in standing. She had troch slide precautions. She stepped over to the commode in order to sidestep.
Mm-hmm.
And just with that abduction, that little abduction, she dislocated her hip.
Ooh.
In standing. It was a pop and then a yell, a scream, like a blood-curdling scream. Okay, so that's one of the safety precautions for total hip replacement that you have to make sure that you integrate into your treatment. Okay. Okay. All right. Let's see. Okay, and then obviously you guys have to review the anterior versus posterior hip precautions, right? Okay.
So when we're doing if like we get a patient who has a total knee or total hip, we're just showing them like the correct way to
Yeah.
like
To
get up
transfer.
out of bed, and to
Yeah.
transfer. So okay.
Yeah. So a lot of times your knee patients won't have a lot of knee flex. Can I have the front one, please? So for the knee patients, for the sit to stands from their bed, a lot of times they won't be able to do, let's say I have a right total knee. They won't be able to do this. They'll probably be doing this. Okay, so you should ask them what hand is stronger than the other, and the reason why, because you want them to be able to push up from the surface. Sometimes they can do it with both, okay, and they're safe doing that because they have the control. But sometimes you want the stronger hand to push up from the surface that you're coming from, and then one hand on the walker. Okay, so let's do it that way. So we're going to just push up like that. Okay, and you're going to show your patient how to do that. Okay, same thing with a hip. A lot of times they will be in that extension position too, just for comfort, and they'll do the same thing. Okay.
Just a quick question. Are we allowed to bring anything with us to this?
Like what?
Oh, just like a piece of paper, like a flashcard.
No.
Oh, no. Just thought I'd ask.
Nope. Nope. Okay. Oh, sorry.